Welcome to my channel, Dr. Arun Gadre YouTube channel. Many of you may be knowing that I am advocating for the healthcare sector reforms in India for last many years. But my exercise was not just academic. In 1984, when I passed my MD Gynec from Grand Medical College in Mumbai, I lived into a tribal area along with my anaesthetist wife, Dr. Jyoti. It was a madness, absolute madness, romantic idealism. It failed. I mean, I took 90,000 rupees that time in 1985-86, and that was 19%, 18% interest. I was charging, out of all idealism, I was charging 3 rupees as a consultancy, 100 rupees for delivery, and 300 rupees for cesarean. I mean, chartered accountant was not needed to declare that this venture is going to fail. I have a Marathi book in that experiences of Kinwat where I practiced. It is a tribal town in Nanded district in Maharashtra. Marathi title is Kinwat Days, Days of Kinwat. It's a story of defeat. I mean, I was raw. I practiced in JJ, St. George. And I directly lived along with my wife into some unknown territory. And the surgery and all that, equipment and all that. But basically, I was not actually knowing the sheer poverty and the market in the tribal area. So it was bound to fail, and the why I am after 40 years, why I am making a YouTube video of it, because my pain to reform the market of healthcare began with Kinwat. Began with my own failure experience. And unfortunately, after 40 years, you will realize that this story is true in entire rural setup of India. It has not changed. So let us begin. The title of the story is The Serious Patient, My Hospital, and 200 rupees. It was a Sunday, a Bazar day, the day of the week reserved for commerce. It is the day when sellers gather to sell and buyers come from the nearby villages to buy. For a person living in a city, every day is a Bazar day. In the villages, however, it is one of the 7 days and always occurs without any compromise. Whether it is a cold or chilly day or a hot or a brazen day, it happens. And a Bazar day is the best business days for even doctors. People bring 5 separate rupees for a doctor. It is their weekly budget. There are tobacco, petrol, clothes, bucket, a sale for transistor, rupee for a movie, 40-page notebook for a child, a rupee for sweet, and similarly 5 rupees for one injection from a doctor. And the doctors wait eagerly for their customers. 20 to 30 syringes are ready, having boiled them thoroughly, and the needles are all ready to. The medical shelves, the dispensaries are filled to the brim. No time to breathe, not even for lunch. Nobody, nobody, even the patients will wait for anybody. Never. They are in hurry as they have to catch the next bus back to their village. They will not wait long, will stretch standing erect and will go away to the next medical shop in their long strides. Of course, to take the injection, nicknamed as a needle, the sui, only from the doctors who are moneylenders for their patient too, there is no alternative. There the patient will sit for any time, compelled to wait endlessly. Outside the medical shop, people chat with tobacco on their palms. Women clutter, converse among themselves with infants to the breast. Men talk about politics endlessly. Locals, locals squat on the floor. Maybe one lights a bidi, a locally made cigarette. Another often handles the priceless 5 rupee note. From the infant of 4 days old to 90-year-old senior, everybody wants that magic needle. And the doctors are ready with everything from the secondary unauthorized market with even B complex injection, tetracycline injection, and of course that magical intravenous dextrose. Oh yeah, for those weighty fellows who have brought 50 rupees cash, the IV saline is waiting for them. Today the collection at that medical shop will be in hundreds, and so it does. It's a Bazar Day, the most valued Bazar Day, the Sunday. Crowd fills the road. Women are moving eagerly, the children are following, the large and stout men are walking effortlessly, the noise is surrounding the crowd. The red turbans, the sweating black faces with shining crisscross lines, the astute air, smell of sweet, tobacco and cigarette. Not even a one ant can move on the road now. There is no pavement. Along the border of the road, the women sellers are busy gathering their stuff. And what a wonderful collection they have. The pepper, the sweets, the mango, chili, cloths, bangles, steel plates, cheap steel plates, and saucers. What a surprise! Somebody has raised a tent somewhere, and in that there are many mirrors. Some are concave, some are convex. The funny show is on. The loudspeakers are crying aloud. And in the corner, there is one super specialist sitting with his magical Ayurvedic drugs. Ancient Indian way of treatment. The so-called special drugs for everything. Yeah, means it is petty quack calling himself super specialist, Ayurvedic. The specialist has smeared his forehead with a white ash. The smell of burning sandalwood is overhanging around. He is from the tribes. And yes, he claims that he can communicate with the spirit as well. But of course, for a fee. The cost of the treatment over there is little more than at my dispensary. But the treatment offered is a permanent one. Oh yes, he can cure piles. Everyone from police officer to district administrator, I mean taluka level lower class clerks, they come to him. He can produce the culprit, the piles, within 5 minutes, and that too without any modern surgery, without anesthesia, without pain. The qualified doctor like me, I comment that, oh, it's not a pile which he produces, but it is just a small bronchial pipe of a hen. Anyway, we would say so because, after all, it is our business which is getting affected by him. And yes, he has a confident treatment for jaundice as well. He applies some torn cloth on the wrist of the patient with the jaundice. And look, the white cloth turns its color into a dark yellow one. A permanent treatment for jaundice. Oh, he has abortion medicine and he has medicine for getting pregnant as well. On that particular Sunday, I have had 20 patients. A miracle. By now it is 3 in the afternoon. Cooked lunch is waiting in the solar cooker back at home. And I and Jyoti are about to leave. Suddenly a group of villagers steadied itself at the door of my dispensary. Hello, they cry. Good morning. How you are the one from Bombay? Yes. Are you around? Well, half an hour. Oh, the condition of our lady is very bad, very bad. Is she pregnant? I asked. She had delivered 4 days back. Some 15 days back, I don't remember. Where is she? Coming. She is coming. She is being brought in the bullock cart. Have a seat, I assured them. What do you charge for examining a patient? They asked. 3 rupees. Hearing my answer, they all look to each other and appear relieved. Whatever they have heard about me had proved correct. They all sit on the bench, quite worried. Which village you are from? They answer some. Oh, I do the calculation. 45 plus 26, around 65 kilometers away. So, I ask, we have tried so many doctors, taken needles worth hundreds of rupees. Yesterday, the teacher in our village told us about you. He said that doctor from Bombay would give us a really powerful needle. I am frustrated. After all this, again a powerful needle, an injection. Again and again the bloody injection. One old woman that has all bones and no flesh comes up to the door. She was just one short cloth on her body, shrunken hands, hollow mouth, hair on her scalp like that of a doll. Oh, my son, save my daughter. She starts crying. Others shout at her. She keeps tongue-tied. Tears are in her eyes. Hope on her face. The bullock cart arrives. 10 people come with the woman. Hurriedly, the bullocks are detached from the cart. The woman is brought in. Around 25 persons gather around the examination table. Out, all of you out, I shout. The woman is hardly a teenager, not more than 16-year-old. She is primary, first time pregnant. She had delivered some 10-15 days back. A quick examination reveals the moving chest, frank white colored skin due to lack of blood and fever, drench of energy. There is no blouse over her chest, and there is a specific reason for it. Her right breast has an abscess, a large right breast size of a watermelon. The pus must be around 4 to 5 liters. One small opening is evident, a mixture of the mixed milk and blood and pus is oozing out. Fever 102, pulse 160, BP low. A frank case of peritonitis. The abdomen is painful. A severe agonizing pain is evident on her face. Jyoti examines internally. There is a tear in the perineum. The anus and the vagina have become one part. Pus is oozing out from that opening as well. She gives the history of convulsions. The liver is palpable. There is no need of any great intelligence to form a diagnosis. It is a frank case of septicemia with peritonitis, large breast abscess. Treatment? Well, sir, antibiotics, fluid, incision and drainage under general anesthesia. Prognosis? Excellent with modern medicines. Jyoti and I come out of the examination room, and all are eager. We have to operate. Stunning silence. We have to operate the abscess under general anesthesia. Silence. We have to admit her for at least 4 or 5 days. Hush discussion follows. Cost? I take a deep breath. Not much. Let us calculate. Including the 4-day stay, anesthesia, and my operative charges. I wait for a moment. As usual, there is no point in giving details, and they are interested only in actual cost. Well, my charges are 50 rupees. I sum up. The total will be 300 rupees. So the old woman comes forward, pressing her fingers on my cheek. She urges, "She is like your sister. Please do a favor." I glance at Jyoti, and Jyoti looks at me. Only one point for all of us to ponder upon. If we operate, she will live. 100%. If we do not operate, she will die. 100%. Okay, I say. Jyoti stands. I will not charge my fees. Just bring the medicines. Jyoti sighed. But there are still 250 rupees. Oh my dear, we are all very poor, and those doctors have squeezed us by now. The only tries her last spreading. I am cold. Bring the medicines, I will operate. All are quiet. Discussions ensue in whispers. Just give one powerful needle. Injection, say up to 50 rupees. One of the crowd suggests. I am dumbfounded. Jyoti's eyes are locked in that girl's stare that is being carried away to the bullock cart. They have not paid even my 3 rupees consulting charges, and I do not insist. No. They are not going to the civil hospital in Nanded, distant place, 150 kilometers away. The transport they cannot afford. And they don't really look after the poor over there. Another one comments. We are helpless. The mob vanishes. I closed the door. We both returned back to home on the motorcycle. On our loan amount to set the hospital is distressing me, 90,000 rupees. There is my hospital. I have made it well equipped. I have done post in surgery and orthopedic so that I can go to the village. Jyoti is an anaesthetist. One servant is sleeping in that empty hospital. He takes some 300 rupees salary for doing nothing. And the patient is going away. This was the beginning of our defeat. After many days, one person from the village visits us. What happened? Did you take her to the civil hospital? I inquire. No. From where we would have brought money? Taking the name of the god, the local barber incised the breast with the razor. Anyway, she died. So it was the rift of only 200 rupees between her death in my hospital, between life and death. And this difference of 200 rupees has one more aspect too. It is the question put forward to me by expert in Ivory Tower who represented International Funding Agency when I proposed my project. I gave an interview to the International Funding Agency when I had applied for the assistant to run my hospital in Kinwat. I was rejected because I could not answer their only important question. It was, don't tell about your operation theatre. Just tell us about the plan for preventing diseases. Of course, I had none. So I was refused any help. For that international funding agency, there was no merit in saving a life.